Hi, this is Mariko, the pharmacist. Thank you so much for watching. Please be sure to subscribe to this channel and like and share the video. During this video, we will review COVID-19 symptoms, when to seek emergency medical attention, and over-the-counter medications that can be used to help with some of the symptoms of COVID-19. I do want to give a shout out to all the COVID-19 testers all over the world, especially the COVID-19 tester in Durham, North Carolina, who, I think he stays in Durham, North Carolina, who really inspired me to do this video. So let's talk about the symptoms. So the symptoms, as well as when it's time to seek emergency medical treatment, can be found on the CDC's website, and I will make sure I include that link in the description area. So after COVID-19 came out, we noticed that the hallmark symptoms were cough, fever, and shortness of breath. But as the cases continued to increase, we saw more and more patients reporting other symptoms as well, including fatigue or feeling extremely tired, headache, a loss of taste or smell, congestion, runny nose, nausea, vomiting, and diarrhea. Now let's talk about when it's time to seek emergency medical attention. So if you notice your loved one are experiencing trouble breathing, if you have persistent pain or pressure in your chest, if you have a new onset of mental confusion that was not present before, if they are unable to wake up or stay awake, or if you or them are have bluish lips or a blue face, then you really need to seek emergency medical attention right away. So let's talk about the over-the-counter medications. So I want you to realize that because the COVID-19 is so new and there are new discoveries, new scientific research and evidence coming forth very often, that you really need to check with your local pharmacist or your healthcare provider regarding the most current over-the-counter medication options for some of your COVID-19 symptoms. And I also want you to realize that there is no over-the-counter medication that can cure COVID-19. The over-the-counter medications can only alleviate some of the symptoms of COVID-19. So let's talk about the symptoms. With the fever or muscle or body aches, you can use Tylenol or ibuprofen. For a headache, you can use ibuprofen or naproxen. If you have advanced or chronic kidney disease or have ever had an anaphylactic reaction to aspirin, ibuprofen, or naproxen, or in the event of a coronary artery bypass graft, then these options would not be appropriate for you, and you need to check with your healthcare provider before you take them. For the dry cough, there are actually several products over the counter that you can get. So I'm just going to name a few. You can do a Dayquil product, a Delsum product. You can do cough drops, Vicks cough drops, or Hall's cough drops. And there are several products over the counter that you can get that contain more than one ingredient, contains a few different ingredients to treat the various symptoms. So if you don't want to purchase 3 or 4 different products and you want that one product that contains the various ingredients for your various symptoms and you're not sure which one to get, you can just check with your local pharmacist by contacting them on the phone or through a secure messaging type system. Many pharmacies may allow you to send a message through their pharmacy website or to a pharmacy email address. And all pharmacies right now are going to have strategies in place to minimize contact. So they may have home delivery service, curbside, or drive-through options available. And many retailers are going to have the home delivery service as well. So make sure you're using that home delivery service when it is available, or you can have a loved one go out and pick up those items and just drop them on your doorstep to prevent you from going out into the public unnecessarily, so we can help decrease the risk of the spread. For the sore throat, you can do a chloroseptic throat spray or Cepacol lozenges. For the nausea and vomiting, you can try a product called Emitrol liquid. If you have diabetes, then I don't recommend this for you. You can also do or you can do meclizine tablets. If you have narrow angle glaucoma, then I wouldn't recommend that for you. For the vomiting, you really need to do your best to stay hydrated. So after you vomit, you need to wait about 10 minutes before you try to drink any other fluids. And when you do drink the fluid, try to drink small amounts about every 5 minutes. And when I say small amount, I'm talking about a half an ounce or 15 milliliters. And for the fatigue, I'm not recommending any medication for fatigue. I'm just recommending you get rest and lots of it. Thank you so much for watching. Please be sure to subscribe to this channel and like and share the video.